Hey everyone, when your kid is sick, some symptoms can be, well, they can be really confusing, even scary, right? A headache, a weird, dizzy spell, a moment where they just seem weak. What is going on? Well, today we're going to crack the code on some of these common and sometimes puzzling symptoms in pediatric neurology. It's the question every parent asks themselves. Is this just a bug? Something common, or is it a critical clue to something more? You're watching your child and you just know something's not quite right. The real challenge is figuring out when to worry and when to, just wait it out. It's all about spotting the patterns that really matter. So that's what this explainer is all about. We're going to reveal the key patterns that doctors themselves use to solve some of the most puzzling cases out there. Think of it like this. We're going to become symptom detectives together. We'll look at the exact same clues a pediatric neurologist sees and learn how to tell the difference between a common childhood complaint and something that needs a much closer look. All right, let's open up our first case file. We're going to start with one of the most frequent complaints in childhood, period, the headache. But here's the thing. Not all headaches are created equal, not by a long shot. And the details, they're absolutely everything. Okay, so take a look at this. This chart kind of breaks it down, showing how we can sort headaches by how they act. You've got migraines, right? They're often that throbbing pain, and sometimes vomiting actually makes it feel better. Then you have tension headaches, which feel more like a tight band around the head. But what I really want you to focus on is that last column, the one for a serious cause. See the pattern emerging? The headache hits early in the morning. It gets progressively worse over time. And when there's vomiting, it brings no relief. These are the clues we're hunting for.
So, this is the crucial part. These are the red flags you absolutely need to recognize. A headache that strikes first thing in the morning, or one that's so bad it actually wakes a child up from a deep sleep, that is not typical. Same goes for vomiting that doesn't help at all, any changes in their vision or trouble with their balance, or a headache that just keeps getting worse day after day. These are the signals that say, okay, time to get this checked out right away.
But why are these red flags? What's actually happening? Well, it often comes down to this one concept, intracranial pressure, or ICP. Here's a simple way to think about it. Imagine the skull is a rigid, unbending box. Now, if something inside that box, like a tumor or swelling, starts to grow, it increases the pressure. It's like trying to overinflate a balloon inside that tiny box. And here's the key. When a child is lying down all night, that pressure naturally builds up. And that's why you see those really severe symptoms first thing in the morning. It's a simple mechanical reason for a very serious problem.
And this slide just brilliantly illustrates that number one distinction. Honestly, if you remember just one thing about headaches from this, make it this one. With a classic migraine, vomiting can be like hitting a reset button. It often brings real relief, but with a headache caused by that increased pressure we just talked about, vomiting does absolutely nothing to help. The headache just keeps pounding away. It's such a subtle clue, but it is so powerful.
All right, let's close that case file and move on to our next one. We're now going to tackle what parents often just call funny turns. Those sudden, really strange events that can look incredibly alarming. Everything from just zoning out to full body shaking.
And you know what? Let's start with a classic that looks so dramatic but is not a seizure. This can be one of the most terrifying things for a parent to see, but it's completely benign. I'm talking about breath-holding spells.
The absolute key to knowing it's a breath-holding spell is its super predictable sequence. It always starts with a clear trigger. A toddler gets really mad or maybe takes a little fall. They let out a big cry, and then they stop. They hold their breath. They might turn a bit blue or really pale, go limp for a second, maybe even have a few little jerks. And then, just as suddenly as it started, it's over. They're back to normal. That pattern is everything. And that right there is the absolute diagnostic key. An unprovoked seizure just happens out of the blue. A breath-holding spell is a reaction. There is always a clear trigger right before the event happens. If you can see that cause and effect relationship, you can be very reassured.
Okay, now let's contrast that with the type of funny turn that is a true medical emergency, one where recognizing the pattern isn't just helpful, it can be absolutely life-changing. We're talking about infantile spasms. When it comes to infantile spasms, doctors are looking for a classic triad of symptoms. First, there are the spasms themselves. These are these sudden, brief little crunches where the baby's head, torso, and limbs all flex forward at once. They often happen in clusters, one after another, especially right when they're waking up. Second, there's a really chaotic brainwave pattern that doctors can see on an EEG. And third, and this is so critical, is developmental regression. The baby might stop smiling, lose head control, or forget skills they had just learned. It's a major red flag. Now, not all funny turns are as dramatic as that. Some are incredibly subtle. Let's take a look at absent seizures. These can be so easily mistaken for simple daydreaming or a kid who's just not paying attention.
The clues here are subtle, but they're very specific. It's not just staring off into space. You might see a really rapid eyelid flutter during the episode. These spells are super brief, just a few seconds long, and you can often actually bring one on by asking the child to hyperventilate. And here's a really crucial point for the medical teams. Treating this with the wrong kind of anti-seizure medication can actually make the seizures worse. So getting this diagnosis right is absolutely paramount.
So any seizure can be scary to witness, but when does it actually cross the line into a true medical emergency? That's a condition called status epilepticus, and the definition is actually really simple. It's any seizure that lasts longer than 5 minutes.
And when that happens, there is a very clear time-based protocol to follow. For the first 5 minutes, your job is simple. Stay calm, keep the child safe, and time the event. You don't treat it yet, but as soon as you cross that 5-minute mark, it's go time. A first-line rescue medication is given. If the seizure is still going after another 5 minutes, a second dose is given. And if it's still ongoing after that, it's time to call for emergency services and get to a hospital for IV medication. It's a clear escalation of care based on time.
Okay, for our final case file, we're going to shift our focus a bit. We're moving from the brain's electrical activity to the nerves that control our muscles, and we'll be looking for telltale patterns of weakness.
So I want you to imagine this scenario. Your child gets over a stomach bug or a bad cold, seems fine, and then a week or two later, they start to seem weak. This is the classic setup for a condition called Guillain-Barré syndrome, or GBS. What's happening is the body's own immune system, after fighting off that initial infection, gets confused and mistakenly starts attacking the nerves.
The key features here create a really distinct pattern. It almost always starts with a weakness that characteristically ascends. It moves up the body, usually beginning in the legs and feet. There's almost always that history of a recent illness. And when a doctor checks reflexes, like tapping the knee, there's little to no reaction. That finding of absent reflexes, it's called areflexia, is the cardinal sign of GBS. So, if you take just one thing away about GBS, please remember this pattern. It's a weakness that begins in the feet and legs and seems to be climbing up the body day by day. That is the absolute signature clue that demands immediate medical evaluation.
Wow, we've covered a lot of ground, haven't we? From headaches to seizures to muscle weakness. So let's pull it all together. Let's consolidate everything we've learned into a final detective toolkit, a master summary of these conditions and their most important clues.
Okay, let's do a rapid-fire recap of our key takeaways. For a serious headache, you're looking for that early morning timing with vomiting that gives no relief. For infantile spasms, it's those clusters of crunching, salam spasms plus a loss of skills. A breath-holding spell, that's defined by a clear trigger that comes first. And for Guillain-Barré syndrome, it's weakness moving up from the legs with absent reflexes, usually after a recent illness. These are the patterns that really matter. So, the goal of recognizing these patterns isn't for you to make a diagnosis at home. Of course not. It's to make you a more informed, more effective observer. By knowing exactly what details to look for, you can give your doctor the precise information they need to solve the puzzle that much faster. You become a truly crucial partner in protecting your child's health.